Welcome to another episode of Skin Experts Education here on YouTube. Today we're going to talk about hyperpigmentation, what's actually causing it, and what the science says actually works. You know, people are buying brightening serums, trying home remedies, and blaming their genes when the reality is that hyperpigmentation isn't just one thing. It has different causes, different mechanisms, and the treatment that works for one type can actually make another type worse. So let's break it down. Here's what's actually happening inside your skin. Your melanocytes, the cells responsible for pigment, get triggered by inflammation, UV exposure, friction, or hormonal signals. When that happens, they go into overdrive, producing more melanin than your skin needs. That excess melanin deposits unevenly in the skin, and that's what you see as dark spots, patches, or uneven tone. There's three main types of hyperpigmentation that we're going to talk about today. First, there's sun-induced hyperpigmentation. This includes what most people see as age spots or sunspots, which is related to photoaging related uneven tone. It's the UV radiation that triggers an inflammatory response in the skin that directly activates these melanocytes. As mentioned in a prior video, research shows that vitamin C combined with ferulic acid and vitamin E has been clinically shown to reduce this type of damage and protect the skin from long-term UV harm. But beyond topical treatments, the most important thing is to wear your broad spectrum SPF every single day, no exceptions. There's no other way to avoid UV damage than to wear the damn sunscreen. The second type of hyperpigmentation that we're going to discuss is friction hyperpigmentation. This is the one that gets overlooked the most. Repetitive rubbing or pressure from clothing, skin folds, or even aggressive skincare treatments triggers the same inflammatory cascade. Mechanical factors play an important role in keratinite proliferation and pigmentation, and friction or sweat can potentiate lesion development in predisposed areas of the body. This is especially common in the inner thighs, underarms, groin, and neck. Treatment here isn't just topical. It starts with identifying and eliminating the source of the friction itself. The third type of hyperpigmentation is hormonal and systemic illness-related hyperpigmentation. This is the one your skincare routine alone cannot fix, because your body's telling you something deeper is going on. Melasma, for instance, driven by estrogen and progesterone, is one example. Research shows estrogen directly increases tyrosinase activity, the enzyme responsible for melanin production, while progesterone enhances melanocyte proliferation, and UV exposure amplifies both of these significantly. Then there's acanthosis nigricans, that dark, velvety hyperpigmentation most commonly seen on the neck, underarms, and skin folds. This condition is commonly associated with insulin resistance and diabetes, where elevated circulating insulin activates IGF receptors, leading to keratinite and dermal fibroblast proliferation. Patients need to understand that this type of hyperpigmentation may not solely be a skin condition. It needs to be evaluated further, especially in middle-aged adults. There's no brightening serum that's going to fix that. The treatment is managing the underlying systemic condition. Now that we review the three most common types of hyperpigmentation, let's talk about what can be treated topically. First-line evidence-based topical treatments include things like hydroquinone, kojic acid, glycolic acid, tranexamic acid, niacinamide, azelaic acid. These are all well supported in the research with strong safety profiles, particularly for darker skin tones where more aggressive treatments can actually trigger more hyperpigmentation. For clinical treatments, things like chemical peels, lasers, microneedling all have evidence behind them, but the key is individualized treatment. What works on one skin type or for one type of hyperpigmentation can particularly cause worse outcomes if you're not careful with knowing the protocols for the different skin tones and types. The bottom line, before you treat hyperpigmentation, you need to know what type you're dealing with, because the wrong approach doesn't just waste your money, it doesn't just cause bad outcomes, it can make things significantly worse and set you up for skin that you're not happy in, or if you're a provider, set you up for potential liability for mistreatment. Well, folks, that's the science. I'm Damian Jenkins, and this is Skin Experts Education, where we go beneath the surface so you can make smarter decisions about your skin and how to treat the skin of others. Take care.